Hello, beauties. Welcome back to Beauty Affair. I am Lindsay Aliseo. Today, I am delighted to be at Greenberg Cosmetic Surgery and Dermatology in Woodbury. Dr. Greenberg and I, we are going to go beyond that beloved and necessary skin treatments and injectables to discuss enhancing our natural beauty from a surgical standpoint. Stay tuned. I am having an affair, a beauty affair, on my journey to optimal skincare, slowing down the effects of aging, and making myself feel fabulous from the inside out. I am jumping into rabbit holes and blasting my way out with knowledge that I want to share with you. Come, follow my journey, learn with me, and let's feel younger together. Please, if you have not done so already, like and subscribe to this channel. You might have to find that white box above our head that says open app first. Thank you. That means the world to me. Ladies, we all do it. We all think about it. We look in the mirror. We think, little nip, little tuck, a little something here, a little something there. Well, let me tell you something. My guest today for Beauty Affair can do it all for you. He is an Ivy League trained, double board certified plastic surgeon with 28 years experience. Award-winning celebrity plastic surgeon, Dr. Steven Greenberg. Welcome to Beauty Affair. How are you today?
Great. Thank you so much for having me.
I am elated to be in this stunning office. It really is gorgeous. Thank you for having me. Dr. Greenberg, the most recent cosmetic trend is a more natural aesthetic versus the old voluptuous, dare I say, a little bit more over-exaggerated feminine silhouette, right?
That's a really good way to put it, but absolutely natural, and that's all I'm into. So whether I'm doing breast, body, facial cosmetic surgery, it's all about looking natural. It's looking like yourself, but only better.
Absolutely. Are you finding that a lot of women now are a little bit maybe afraid of cosmetic surgery because they feel like they may be predestined for that 90s Pam Anderson look from the past?
No, I think it's the opposite. I think people are accepting of cosmetic surgery. People know it can be done in a great natural way, and you don't have to go crazy to look better. So people used to be afraid many years ago. The trend is definitely different. The numbers of cosmetic surgery procedures are coming up year over year, and people are much more accepting. They realize they can have a procedure and then go off to their social events right after.
I am 40-something years old. I've had 2 children. I've had a natural and I've had the C-section. I've also lost a drastic amount of weight up and down, yo-yo, okay? I am currently down 25 pounds since December.
Good
Yay!
job.
Exciting.
Good job.
Thank you. And I'm still going. But now here's the thing. I've aged 10 years and 3 months, Dr. Greenberg. Tell me, what are we going to do to enhance my natural beauty from top to bottom?
Okay, so when I look at a patient's face, I look from hairline down, and I say, okay, what do we do for the forehead? Easy stuff. Botox for the forehead, Botox for the 11 lines, as well as the crow's feet. Different fill substances that we can use for the lines of the face, cheekbones, chin, marionette lines. So fillers work well. If we want to look at a surgical technique, I look at anatomy. I say, okay, what do we have going on? Do we have jowls? You do have a little bit of a jowl there, and that's probably from the weight loss. Do we have extra skin or fat on the neck? We can get rid of these things. I do tons of different types of facelifts. Whether they're mini facelifts or full facelifts, we make an incision that goes around the ear and gently and naturally, as you said, pull back, get the neck cleaned up, get the jowls cleaned up.
Yes.
I tend to take a little fat out and put a little fat injections in at the same time. And sometimes we top it all off with a little light laser peel to get rid of fine lines, wrinkles, dark spots, etc.
Wow. I love the idea of pulling that up and get rid of the jowls. And you know what? And it gets worse and worse as I lose more weight.
Yeah, absolutely. And this is such an easy thing. Done right here in the office ambulatory center. We don't have to go crazy. You don't have to look like that Phyllis Diller old-fashioned look, where you're pulled tight and you look like you're in a wind tunnel. No way. It's all about looking natural. Little nips and little tucks here go a long way to looking great.
They absolutely do. So here is the big question. No, I have two questions. Number one, are you seeing more women at a younger age, as soon as they start losing the elastin, coming to you and saying, I need the facelift now?
Yes, so many younger people are coming in for procedures. I do these little mini tucks, these little mini lifts that we do all the time. I do something called a micro mini lift for the younger patient with zero downtime. So yes, patients are definitely coming in earlier than ever before.
I love that you have almost a customized approach depending on really the age and what they're looking for. Is that...
It's all about customization. It's all about, dealing with what that patient wants to get, not what I want them to get, but what they want. So we can really individualize this approach and really do either a little bit or a lot depending upon their anatomy.
Ladies and gentlemen, did you hear that? He said what you want, not what he wants. We want to hear that. We love to hear that. Okay, my last question. If I, at my 40-something years old, decided I would like to get that facelift, whatever it is we do, the mini, whatever you decided would be great for me, how long does that last? And do I eventually need a new one?
So a facelift, and you're not going to believe this, but a facelift lasts forever. Why does it last forever? Because at any point in your life, you're going to look younger than you would have. So when you're 110, you'll look 100. And when you're 100, you'll look 90, and so on and so forth. Your aging curve is different after a facelift. You age at a younger age for every step of your life. So therefore, a facelift lasts forever. How long until you get back to the way you look now? It's about 10 years, depending upon the person. Could be less, could be more.
There it is, ladies. I'm loving this option. I mean, I'm currently working on doing the lasers and the microneedling, but there is always a facelift, and I am down. Sign me up. I would like to thank you for being one of my sponsors for Beauty Affair 2023. I'm very excited.
Well, we look forward to being there with you that day.
Yes, and I'm sorry that you personally can't be there because I know you have a wedding.
A little bit.
But I am very excited that this practice is going to be here. I think Dr. Stephanie Cooper is going to be here at the event, and we're very grateful for Dr. Greenberg for being one of our top sponsors. Dr. Greenberg, thank you so much for joining me today on Beauty Affair.
Thanks for having me.
And guys, I love you, I appreciate you, and have a fabulous day. Please like, love, subscribe, and follow Beauty Affair Bougie Brunch Tickets at beautyaffairpod.com.